Uh, it's very aptly said that if the childhood obesity epidemic remains unchecked, it would condemn many of our kids to shorter lives, as well as financial and emotional burdens of poor health. A few years back, when I saw this warped re-evolution theory, I thought it doesn't affect us. It's more for a country like America, where there's an obesity epidemic. But then we realized over the years that no, it's a global epidemic which affects all countries. And in fact, in developing countries, with all due respect to the ladies here, there are more overweight ladies than underweight ladies at present. But the stark reality is that more than 170 million children under the age of 18 years globally are overweight or obese as of today. So could we just blame this childhood obesity epidemic on sedentary lifestyle, the fast food, and the increasing gadgets? I guess not. There's something more than what meets the eye. WHO says that more than 43 million kids under 5 years of age are also overweight and obese. And it is being increasingly recognized that obesity sets in by the age of 2 years in many of the obese individuals. So nutrition in early life does play a very, very important role in this obesity epidemic. So what could be the link between feeding in infancy and the risk of childhood obesity and obesity later on in life? Well, as we all know, WHO has been recommending 6 months of exclusive breastfeeding for the past many, many years. And we also know how poor the uptake of this recommendation has been, not just in our country, but globally the rates of exclusive breastfeeding are not encouraging at all. While at the same time, the obesity epidemic has been increasing at an accelerated pace. So could there be a causal relationship here, reducing breastfeeding rates and increasing obesity? There have been a number of studies on this topic. Let's look at this meta-analysis by Harder et al., where they showed that breastfeeding reduces the risk of later obesity and overweight by 25%. And each month of breastfeeding reduces the risk of overweight by 4%. But no confounding factors were considered for this analysis. At the same time, Owen et al. Came out with this systematic review of 70 published and unpublished data where they showed that yes, there was a very minimal lower BMI in breastfed children as compared to formula-fed children. But once these results were adjusted for confounders like the maternal obesity, maternal socioeconomic status, the result disappeared. There was no benefit seen. So they concluded that there is no association between breastfeeding and later risk of obesity, though for many, many other reasons, we should continue to promote breastfeeding. In this paper, the authors reviewed all the data pertaining to developing countries, and they came out with the recommendation that currently there is no conclusive evidence between the relationship of breastfeeding and later obesity. And further trials are required. So that brought this thought in my mind, maybe we are pushing in too many solids too soon, or could it be that these fortified cereals that we've been using, could they be the culprit and leading to early onset obesity in our children? To study this, the data for this intervention is not as huge as for breastfeeding, but there are studies which have shown that among breastfed infants, the timing of introduction of solid foods is not related to later risk of overweight. Whereas in formula-fed infants, especially in this study, they found a 6-fold higher risk of obesity if solids were introduced before 4 months of age. And there are a number of other studies where they've shown early use of solids, that is before 12 to 15 weeks, leads to a higher risk of obesity. So again, we look at the systematic review where they took 24 studies. There were more than 34,000 subjects. And they found that the timing of solid food introduction did not have a conclusive relationship between later risk of obesity. And the recommendations still stay that solid foods can be introduced between 4 and 6 months. In the developed world, they're still following that. Well, could it be that we are pushing in too many fats and sugars into our infants and leading to obesity? Again, this review they took animal as well as human studies, and they found that higher fat intake during infancy and early childhood was not associated with obesity later on in life. People have even studied high sucrose intake during infancy, and they have also been unable to conclusively prove a relationship between high sucrose intake and later obesity. But let's not jump the gun here. The authors also said that low sucrose intake throughout childhood had a better nutrient intake and a better growth parameters than the high sucrose intake group. So we come to the protein. Could the protein be the culprit? And now there is emerging data from many countries that high protein intake in early life is related to obesity later on. I'll quote this landmark study. This was a double-blind randomized controlled trial by the European Childhood Obesity Trial Group, where they took about 1,200 formula-fed infants, and they were randomly assigned between two groups. One group got a lower protein intake throughout the first year of life, and one group got formulas which had a higher protein intake. And they compared this with a group of exclusively breastfed children. What they found was, at 24 months, the lengths of all children were comparable. There was no difference. But the weight for height, or the BMI, was 20% lesser in the group which got a lower protein formula. And the growth of this group was comparable to the exclusively breastfed group. So they concluded that lower protein intake during infancy and early childhood could have a protective effect for later obesity risk. This recent review from 2014 evaluated in the entire gamut of studies on protein intake, and they found, they reiterated that yes, the largest source of protein in infancy is cow's milk and infant formula. The critical factor here pointed out was the percentage of energy that a child gets from protein. And in a breastfed child, it is only 5%, whereas in a formula-fed child, this is 7 to 9%. And in a cow milk-fed child, the percentage of energy from protein that child is getting is 20%. And in our country, where people are so fond of pushing toned milk, the percentage of energy from protein jumps to almost 30%. Considering the negative effects of high protein intake on the later obesity risk, the authors concluded that it is time that we should consider lowering the higher protein limits in the formulas for first year, and we should limit the intake of cow milk in the second year of life, especially the low-fat cow milk. So after reviewing all this data for breastfeeding, complementary feeding, fats and proteins, etc., are there any interventions that we can propose to reduce the risk of obesity in developing countries? Well, we must encourage and enhance breastfeeding, definitely. We must ensure timely introduction of complementary foods appropriately given. We should avoid cow milk in infancy and prefer a formula which has a lower protein in it. Must limit intake of cow milk, especially the low fat, the reduced fat cow milk, in the second year of life. Thank you.